Welcome students, I am Akshay Jier, lecturer of Emmanuel Arthur College of Pharmacy. Today we are going to see about anti-anginal drugs. First of all, what is anti-anginal drugs? Anti-anginal drugs are used to treat chest pain by improving heart blood flow, reducing oxygen demand or both primarily through their medications. And it is characterized by sudden severe pressing chest pain or heaviness. It is often associated with diaporesis, tachypnea, and nausea. It is also characterized by coronary flow that is insufficient to meet oxygen demands of the myocardium. There are three types of angina. First one, stable angina, unstable angina, and variant angina. Stable angina. They are predictable, provoked by exercises and emotions. Stable indicates reproducible nature of angina, and the same activity at the same intensity faithfully produces the same symptoms. Unstable angina. The unstable angina is characterized by recurrent attack of angina. It occurs with minimal excretion. It is precipitated due to the combination of atherosclerotic platelet aggregation and at ruptured plate and vasospasm. Third one is variant angina. It occurs in young individuals. So it is the relatively uncommon pattern of myocardial ischemia usually occurring in rest or during sleep. It is induced by coronary artery vasospasm and it is generally response prompted to vasodilators. Now, classification of anti-anginal drugs. There are 5 classifications: nitrates, beta blockers, calcium channel blockers, potassium channel opener, and others. First, nitrates. It is classified into short-acting and long-acting. Short-acting examples: glyceryl dinitrate and nitroglycerin. Long-acting examples: isosorbate dinitrate, isosorbate mononitrate, etc. Next one, beta blockers: propranolol, metoprolol, and anginal, etc. Then calcium channel blockers: phenylalkylamine, verapamil, benzodiazepine, diltiazem, and hydropyridamines, ifidipine, felodipine, etc. The fourth one is potassium channel blockers: nicorandin, others ranitidine, oxypenicillin, etc. First one, nitrates. They act directly on the smooth muscles of body and then relax them. They release nitric oxide when it is powerful muscle relaxants, most predominant in the vascular smooth muscles, that is in the walls of arteries and veins. Actions of nitrates: effects on other smooth muscles, redistribution of coronary flow after reduction and preload reduction. Nitroglycerin relaxes vascular smooth muscles and dilates both arterial and venous vessels. Dilation of vessels is more predominant than dilation of arteries, resulting in peripheral pooling of blood, decreased venous return, and decreased preload. Effects on other smooth muscles: it relaxes the bronchi, biliary tracts, esophageal muscles. It also dilates cutaneous vessels and meningeal vessels. Beta 2 blockers. Beta 2 blockers reduce the cardiac workload and oxygen consumption. This drug do not dilate coronary blood vessels. Total coronary flow is reduced due to the blockage of beta 2 receptor. It also increases the exercise tolerance in classical angina. It also decreases frequency and severity of attack. Third one, calcium channel blocker. Three important classes of calcium channel blockers are exemplified as verapamil, ifidipine, and diltiazem. Calcium channel blockers. There are types of calcium channels has been described in smooth muscles as voltage sensitive channel, receptor operator channel, and leak channel. Fourth one is potassium channel openers. This dual mechanism anti-anginal drugs activates ATP sensitive potassium channels, thereby hyperpolarizing vascular smooth muscles. The vasodilator action is partially antagonized by potassium channels blockers. Glibenclamide like nitrates, it also acts as anodonor, relaxes blood vessels by increasing the CGMP. Other anti-anginal drugs, trimethazidine. This anti-anginal drug acts by non-hemodynamic mechanisms. There is no effect on the determinants of myocardial oxygen consumption such as HR and BP. Both at rest during excited, but angina frequency is reduced and excessive capacity is increased. Adverse effects of nitrates: headache, flushing, postural hypertension, hemoglobinuria, contact dermatitis, calcium channel blockers, constipation, headache, dermatitis, beta blockers, hypertension, depression, bradycardia, and heart block, congestive heart failure. Therapeutic uses of anti-anginal drugs. Nitrates. Angina pectoris, myocardial infarction, congestive heart failure, biliary colic, cyanide poisoning, anti-esophageal spasm, beta and calcium channel blocker, hypertension, angina, cardiac arrhythmias. Thank you.